At one point, my husband says, you know, doctor, take her kidney. Since the kidney is completely covered and it's not functioning, take her kidney. And the doctor said no, and nobody in this hospital will do it. She's terminal. She has a few months to live. Why put her through that kind of an operation?
And I was feeling a little better, and I figured, okay, that's great. I'm done with this thing. Well, as soon as I got off of the antibiotics, this thing started to come back again.
I had a woman I worked for 15 years at the time. She came and she said, Doris, she's not going to make it. She told my mother, she's going to die.
I went to a top oncologist breast oncologist in Sloan Kettering, and he said that he put his I remember he saying to me, I put my 40 years experience on the line here. If you don't do this chemotherapy regimen that I recommend, your chance of survival is 15. If you do it, it's 65 or something like this.
They wanted to do chemo just to make sure that there wasn't any cancer in my lymph system. I agreed to one treatment, and it made me so sick, I told the doctor, I said, I will not continue at this time. And it was during that point in time that I was introduced to the Foundation for Advancement in Cancer Therapy.
In a world under assault from pollutants that bombard our environment and chemicals that contaminate our food and water, cancer is on the rise. Over 10 million Americans are already afflicted. 1.5 million new cases are expected to develop this year. And despite the increasing effectiveness of chemotherapy and radiation to effect remissions and prolong life, 1 in 2 men and 1 in 3 women will eventually develop or die from the disease. Over 500,000 people in the United States alone will die from cancer this year. Because of this grim prognosis, and because the toxic nature of conventional therapies destroys healthy cells even as it kills malignant ones, an increasing number of doctors and patients are now exploring safe, established biological alternatives as a cure for cancer and other diseases. One of the foremost organizations promoting a biological approach to cancer treatment has been FACT, the Foundation for Advancement in Cancer Therapy. For almost 40 years, until her death at the age of 93, its president, Ruth Sackman, had been raising the awareness of physicians and patients about fighting cancer and other diseases by natural means. Her work, however, continues to be carried on by a number of physicians and other medical professionals who share her approach to preventing and combating disease. Among them is Dr. Philip Incao.
My name is Dr. Philip Incao. I've been a physician for over 40 years, and for most of those years, I've practiced a form of integrative medicine called anthroposophic medicine. I first met Ruth Sackman, the founder and director of FACT, in 1981, when my wife and I consulted Ruth about my wife's breast cancer. Ruth helped my wife very much, and after that, Ruth and I became good friends and co-workers until Ruth's recent death at the age of 93. Ruth firmly believed, as I do, that we all have the potential to heal ourselves of cancer and other serious illnesses. For over 35 years, Ruth helped more than 1,000 people with cancer who chose a safe, nutritional, restorative treatment instead of relying solely on conventional cancer therapy. In this program, you will meet 5 people who sought guidance from FACT. 4 of them were diagnosed with cancer. 1 was diagnosed with Lyme disease, and all of them have been disease-free for no less than 13 years, and in some cases, for more than 30 years. All are well-documented cases and are representative of a large pool of long-term recovered patients assisted by FACT. At the conclusion of these interviews, I will have a conversation with Dr. Cheryl Leventhal about the significance of these cases. Dr. Leventhal is a former oncologist and is currently a practitioner of functional medicine.
In November of '93, I was going for my yearly checkup. That was a thing to do. I was very healthy, but the checkup had to be done every year. And my doctor had an X-ray machine in his office, and he would X-ray the chest. And he called me home, and he said, you know, Rita, I see a little pin spot on your lung. It wasn't there a year ago. I need you to go to a radiologist who is more professional. So it took a week or two, and I went to a radiologist, and he called the doctor, and he says, yeah, I see that little pin spot, but you know what? We don't know what it is. Have her come back in 3 months. And the doctor said, no. If it's there today and it wasn't there yesterday, I'm not waiting 3 months. He called me, and he directed me to for CT, a body scan. And that was on the 17th of November, '93. And we came home, and 4 o'clock, I got a call from the doctor, and his statement is, Rita, you have cancer. And I say, where? And he says, all over. I said, what do you mean all over? He says, in the kidney, in the liver, in the lungs. You need to go to see an oncologist. And he got me an appointment in Sloan Kettering. They immediately said that it's renal cell carcinoma with metastasis to the lung. In plain language, it's kidney cancer and spread into the lungs. Every time we went there, he underlined, you are terminal, you are terminal. At one point, my husband says, you know, doctor, take her kidney. Since the kidney is completely covered and it's not functioning, take her kidney. And the doctor said, no, and nobody in this hospital will do it. She's terminal. She has a few months to live. Why put her through that kind of an operation? At the same time, my husband spoke to his cousin in Florida, who is a kidney specialist for children. And he requested all the information. We sent him these slides from the biopsy and the tests. And he called, he says, you come right down here. You're a walking bomb. That kidney has to come out. When I arrived in Florida, it was the end of December. I received a phone call from a friend who said, Rita, I would like to come with my son. I have met her son once before, and he looked peculiar. And it was explained to me that he's a vegetarian, so I thought vegetarians look peculiar. But I agreed, and I prepared orange juice, I made a salad. I made sure that the man had something vegetarian to eat. And he explained to me that he is a cancer survivor. He is a member of FACT organization. He spoke about Ruth Sackman. And he said, you know, Rita, you don't have to die. You don't even have to be sick. You just have to change lifestyle. And he took a yellow pad, and he drew a line in the middle. And he said, as of this minute, you have to stop eating meat, chicken. You have to stop drinking milk, eating cheese. You cannot open cans. A very, very long list. On the right side, he wrote organic egg, organic vegetable, organic fruit, a little soup. And Rita, you need to detoxify, you'll be okay. And I looked at him, and I said, no wonder he looks peculiar. He's crazy. If I follow his direction, I am not going to die of cancer. I will probably die of hunger. And I really ignored what he said. He left. And about 3-4 days after he left, I got a call from the hospital that they have to postpone the operation because I'm extremely anemic. And they have to build me up with iron pills. So I called Daniel. And I told him, he says, under no circumstances are you to take iron pills. If you're anemic, I need you to drink organic beets, carrots, organic spinach and carrots, 2-3 times a day. After 2 weeks, I went back to the hospital for a blood test. And the nurse came out and she says, Rita, I'm so sorry. In the lab, they mixed up your blood with somebody else. I have to do it again. Go, do it. She comes out after 10 minutes. She says, you know what? We don't know what's going on. You're not anemic, and you have enough blood to donate toward your operation. They checked it again. They spoke to the doctor, and I'm not anemic. So they rescheduled it for March 9th. And as we're driving home, I said to my husband, you know, all my life I was anemic, and everything the doctors did, nothing helped. For 2 weeks, I'm drinking the juice, and I'm not anemic. There is something to this kind of approach. The doctor who was preparing to operate on me took me to an oncologist because he was practicing something new called immunotherapy. And a month and a half after the operation, I went back to the doctor, and he did a chest x-ray, and he says, you know what, I like your approach. Let's wait with the immunotherapy. You continue doing what you're doing, and I'm gonna watch you. The only reason he didn't push for immunotherapy is after my lifestyle, he saw less nodules. At one point, he saw 12. At another point, he saw them a little weaker, not as obvious. And little by little, at one point, he says, you know, I see only 9. He says, let's continue doing what you're doing, Rita. It looks good. And I was doing my stuff, and he was checking on me. And every time I came, he says, it looks good. It looks good. So I never had immunotherapy. I never had chemotherapy or radiation. And I worked with Daniel for about 1.5 years, almost daily. He would call me. He would stay with me on the phone. He would teach me how get away from stress. He would fill in some parts about what I should eat. I became a fanatic. I eat only organic. I cook my own meals. I drink juices. I drink only distilled water that I make my own. And finally, Daniel said, that's it, Rita. I have taught you whatever I could. You must call Ruth. And at that point, I called Ruth Sackman. And I think the day I called her, I was born. She has taught me what life is all about. I mean, healthy life. She taught me it's okay to feel sick because it doesn't mean you're sick. Our body is in a detoxification state many, many times. And when you detoxify, it could be a headache, it could be throwing up, it could be diarrhea, it could be stomachache, it could be blood in urine, it could be anything. Do not get scared. Do not run to a doctor. Give yourself a few days. Ruth gave me a list of juices, and my husband would do the juice. Then I would have a fresh vegetable soup from organic vegetable that my husband cooked. I would have a lot of salad. And my main meal was organic fruit. I would eat every fruit that was in the season. And as weak as I was exercising. I think being with Ruth, seeing what happened to me, and seeing that everything she said is true, I became a self-reliant person, and I don't let doctors twist my arm. And 13 years later, I'm here, even though the doctors gave me only 2 months to live.
When I was young, in 5th grade, I had a problem with my right elbow. Many years later, I had a similar, I would say identical problem in my left wrist, where my left wrist swelled up pretty much to the size of a tennis ball. And finally, at age 28, it got very severe. It was in 1978, almost 30 years ago. And it was cancer. It was not only in my bone, but it was also in my lymph system. They scheduled a series of radiation treatments just to the wrist. And then after we finished that course of treatment, they wanted to do chemo just to make sure that there wasn't any cancer in my lymph system. I agreed to one treatment, and it made me so sick, I told the doctor, I said, I will not continue at this time. And it was during that point in time that I was introduced to the Foundation for Advancement in Cancer Therapy. And I started interviewing people, and my preference was people who had a long-term survival rate, because I figured those are the people who've been there, done that. And I grabbed everybody I could, and it was very intensive. So it left me with a great deal of hope and confidence, because when you talk to people who've been there and done it and have been around for 7, 8, 10 years to talk about it, and some of these people were deathly ill, much worse off than I was. I place a lot of emphasis on that. I don't want the guy who got over cancer last year and, gee, I'm feeling great, and say, oh, great, I'll go do what he did. Well, I have too many good friends who have died after being told that they were 100% cured. So when I went back to my doctor, that was the point at which I'd already half made up my mind, but I was still kind of scared to leave the experts behind. I'll use that in quotes. And so I gave him an hour-and-a-half exam. I had 3 pages of questions, and I have to say he was very kind, gave me a lot of time, answered all my questions as fully as he could. And at the end of the interview, I was not overly impressed. I was impressed with him as a man and his intelligence and his training, but I wasn't impressed with his results. And it was at that point in time I told him I had decided I was going to go another route. And he asked what it was, and I told him that I was going to follow the Foundation's recommendations, and he got furious with me. At which point in time he lost his temper. He felt I was going down a quack route. I was taking something that was going to lead me astray and waste valuable time, and in the meantime, cancer would be spreading and I'd be dying and all that. And it was interesting because he was trying to sell me on his approach, and he was saying, you know, I lost my mother to cancer, and I lost my sister to cancer, and I lost my sister-in-law to cancer, and don't you think I would have done everything in my power to save them? And I thought, well, yeah, it would. I said, but you're not really selling me. You're not very convincing, because, you know, he's sitting here telling me about his failures and with his loved ones. And I'm thinking, okay. And I think he had as good or better a track record than many oncologists. So all it did was cement my resolve. Once I decided that I was going to leave orthodox medicine behind and try the route that I had learned about with the Foundation, the first thing I realized was that I really could not rely on the doctor to make me well. I had to become my own prime contractor, so to speak. I was going to make the decisions. My first decision, of course, was to take a different route. And that's a little daunting, but it's also, I think, part of your healing process, because I was no longer relying on someone else to make me well. I was going to make me well. Ruth connected me with William Kelly, who had recovered from pancreatic cancer many years ago. And he had a very, very intensive program, which I went on. Huge questionnaires, personal interviews, and they come up with a dietary regimen, supplements, body cleansing, internal and external. Very, very thorough program. And what they try to do is focus on your metabolic type to determine what's the ideal diet for you. What is your body missing? What nutrients are you lacking? What organs are not functioning properly? So they come up with a complete program, both food, liquids, body cleansing, and supplementation, and other aspects as well. And I got this huge manual that I had to follow, and I followed it extremely religiously. When I started the Kelly program, of course, I had a lot of physical pain from the cancer because I had a very weak left wrist. I was overweight. I was sluggish and had very little energy. But after being on the program for probably 3 or 4 weeks, I actually started feeling a little worse. Like I mentioned earlier, detoxifying dumps stuff. Your body knows when it's time, knows when it's strong enough to start getting rid of the junk. And it won't do it until it's capable of doing so, or at least that's been my experience. When I started getting these healing crises, they call them, where you're dumping toxicity out of your cells and into your eliminative channels, and you start feeling sick, of course, the first thing you think about is, oh God, you know, what do I have? Oh, what happened? I'm getting worse. Of course, I would call Ruth and say, geez, what's going on here? And she'd say, don't worry, you're doing just fine. And of course, you do worry at first, you know, because, you know, you're cancer's scary. You know, you don't really want to die. With her guidance still, I kept a base level of supplements, a lot of pancreatic enzymes, a lot of supplements to help boost those organs that you really need to get healthy, your thymus, your thyroid, your liver, your pancreas. As I went through the program, there was a test called the human chorionic gonadotrophin analysis, which is a simple urine test that measures the presence of the HCG hormone in your system. Although it's not a direct measure of cancer activity, what it does is it shows the degree of cell division occurring in your body. As I started to feel better, I could see my levels of this hormone dropping, which indicates a lower degree of cell activity. Well, first off, that's good emotionally because you say, oh, good, the activity is dropping. When I first got out of the hospital, just moving my wrist that much was excruciating pain. I couldn't do anything with my wrist. And I have never done anything since that time other than the program that I've been on for years. And my wrist has grown back. I'm a classical guitarist. And it's amazing that I can still play classical guitar today. And that's very strenuous on your left wrist. ACT was instrumental in my recovery. And Ruth monitors people over the long haul because that's what she's interested in. She's not interested in the whiz-bang cure of today. She wants the proven, time-honored, effective technologies, the things that work. So biorepair really is a good term to describe what we went on. But you're not using drugs to biorepair. You know, you're cleaning out the junk, you're putting in the good stuff, you're giving your body what it needs to thrive, and you're giving it the right environment, and it's a lifestyle change. I just know that the body's remarkably resilient, and if you just give it half a chance and you do the things right, if you get the bad stuff out and you put the good stuff in, and you get your attitude right, and you take charge, you can do it. Of course, it's much smarter. You just stay on a good program all your life. I'm sure you're gonna live longer, and you're gonna be healthier, you're gonna be happier, but hey, there it is.
My cancer diagnosis happened while I was studying for the master. Since I was in infertility treatment, I was seeing doctors all the time. And I just had a checkup a month before I touched my breast and I feel a pretty large tumor. And I go back to my gynecologist and he touches it and, oh, you won't die from this, this is nothing. 3 months later or 4 months later, I'm seeing my gynecologist for my infertility testing and so, and he checks me and said, I don't like this. And this is an NYU doctor and said, I want you to go get it out or at least have a biopsy. I go get a biopsy and this is a cancer and apparently it's an aggressive type of cancer. I remember the date of the diagnosis was the 29th of December, 1982, because a year later on that date, my first daughter was born. And I thought to me that was a kind of the triumph of my will, and I got a confirmation that, yes, this is going to be life, not death. I didn't dare do nothing, so I did have a mastectomy, and then, of course, they recommended radiation and chemotherapy, and I went to a top oncologist breast oncologist in Sloan Kettering, and he said that he put his I remember he saying to me, I put my 40 years experience on the line here. If you don't do this chemotherapy regimen that I recommend, your chance of survival is 15. If you do it, it's 65 or something like this. And I said to myself, I'm not doing it. The thought that made me decide is that spending my last year feeling horrible, because I know what chemotherapy feels like, that was not the way I wanted to end my life. So basically, I went to the alternative route, not with the idea that I necessarily will be successful, but with the idea that at least I'll have a choice about how I live the last part of my life. A friend kind of mentioned to me that there is this organization that I could call and get some information. It wasn't easy talking to Ruth in the beginning. It wasn't easy either. It wasn't an immediate because Ruth is a warrior, you know. And she's very harsh. And this is the time a cancer diagnosis always is a very scary and very frightening experience. It's maybe the first time as a young person, and I think also at any age, it's the first time that you kind of face your mortality, because we do live as if we will live forever. So I figured out then that Ruth may have very, very useful information for me, but she will not be somebody who will be very helpful in helping me with my emotional struggle here. And in some ways, I think her strong opinions were helpful too, because this alternative is a very demanding alternative. It's a much more demanding than just going to the doctor and putting your arm out and sitting through a chemotherapy session. It really requires a total transformation of all your habits and your way of thinking and about everything. It's not only about food and health but it's about life in general. And the alternative that Ruth suggested was that I'm becoming the agent of my life, of my health, but it takes a lot of work, it takes a lot of discipline. The really revolutionary idea in my mind is that the body has a capacity to heal itself, and that all we need to do really is to bring it into a place where it can do the healing that it knows how to do better than any doctors and any human. We don't have the wisdom of the body. That required change in diet, meaning moving towards organic food as much as I can, towards raw food as much as possible, because you want to get the life energy that in the food. And then the cleansing, because my understanding that particularly with breast cancer, the state of the colon is really crucial, and how clean or unclean the colon is. So I started with a very rigorous cleansing program. The knowledge that you've done everything you can, to me there was something very reassuring about it. And beyond this, now I can wait calmly. I don't wait anxiously. I'm waiting very calmly, because I know everything that could have done have been done. It's not like esoteric belief that makes no sense. I think to me it makes deep sense. But I'm not trying to, and at the time I didn't talk to anybody else. I didn't want scientific proof for anything, for any of these claims. It didn't interest me. It made sense to me. It just made sense that this body has this wisdom to heal itself, and all I need to do is help it. And it makes sense, that's all. What else can I say?
A lot of times we would go out after work. There was golf courses fairly nearby, and we would go out and we'd play golf either on the weekend and talk through work situations or what have you. I looked down and I had the red ring, the classic, I guess you would call it a classic red ring on my arm. So I said, okay, so I got bit by something. And it was at the time where Lyme disease was not popularized, if you will. So not everybody knew about it. And I'd say over the course of several weeks, I started to get a headache. I started not to feel so well. Definitely could not sleep well. Then went to my family physician, and he recommended, the standard course of antibiotics. And I did start to feel better. I was like, okay, this is great. I'm starting to sleep. It wasn't 100%. Well, as soon as I got off of the antibiotics, this thing started to come back again. So that my doctor had recommended that I go see a specialist over at Yale. The course of action that they wanted to take was using what I understood to be a powerful antibiotic called Rocephin. So I started feeling great. I wouldn't say 100%, but it was like, oh my God, I'm getting some relief. I'm starting to sleep. The symptoms were going away, which was great. Finished the course of antibiotics, which was like, oh, thank goodness. 2 or 3 weeks later, symptoms were back again. Same symptoms, just as powerful, felt just as lousy. So I went back to the specialist and it was like, can you please help me, right? So We know the antibiotics appeared to be working. What can we do to get this thing, wiped out of my system? The course of action that we'd like to take is we'd like to double the dose. We're confident doubling the dose, will wipe this thing out. And I'm thinking, okay, let's see, you were confident before that the original dose was going to wipe it out, but it didn't do it. But now you're confident to double the dose of antibiotics, which, was already impacting my system anyway. And I'm thinking, this just doesn't sound right. Luckily, at the same time, a friend of mine who lived in the city, who I was talking to, I was going through my whole scenario of what was going on, and my friend said, well, I know of this organization called FACT, and you should give them a call. And Ruth Sackman, you should contact Ruth Sackman and just go through what you're going through. And I'm thinking, okay, FACT, and they said, well, it's an organization that helps with cancer treatment and the like. And I'm thinking, well, I don't have cancer, at least I don't think so, and is this the right fit? You don't want to go to the foot doctor if you're having a problem with, your elbow or something, right? I called up Ruth, and I started to talk her through what my symptoms were. And she's very matter of fact, right? So, and I was told this from my friend. It was like, Ruth's a fabulous person, great person, but she's going to be matter of fact. Here's what it is. Here's what I want you to do. And if you would like to try it, you need to do it. You can't play with, hey, I'm going to do the antibiotics as well, just as a backup, and do this whole thing, right? Because they're counterproductive. They don't work well together, right? I had to talk to her several times and it wasn't to understand. Ruth was very clear, right? But, it was a matter of getting an understanding of what is it that I needed to do? How would it help me? And why would I be doing this when a doctor isn't telling me this stuff? And I was trying to really understand, okay, so everything makes sense, from what Ruth was saying. So I said, well, why wouldn't I do this? But then I thought, okay, well, she's not my doctor, she's not, I haven't checked her credentials, this is a person that I'm talking to on the phone and getting great, suggestions and advice. But it's like, well, should I do it? And it's like, well, there's no medications. Well, why wouldn't I do it? It makes a lot of sense. Why wouldn't I try it? So my thought was, great, Ruth, let's move forward with this. And that's when I started to go through, I'll call it the treatment with her. Her suggestions of what would help detoxify my system. And Ruth was great. Talked me through every step of the way. And really said, you're going to take fluids to help make sure you're not going to get dehydrated. There's certain combinations of vitamins, herbs, and I would take that stuff, and it was like amazing. As I went through the day, I remember getting reactions. My body was reacting. I think my face was getting exceptionally red, and I'd call Ruth, I'm getting a reaction. Should I stop this whole thing? What's going on? It's like, no, that's a normal reaction that, people would get to, as you're detoxifying, you're going to sweat because, your body's trying to rid itself of the toxicity. And actually, what I found at the end of the first day, and as I got into the second day, and I think it was around, 24 to 48 hours, 80% of my symptoms had totally left. And that was the first time that I felt so great like that. And my mind was getting so clear. And it's like, my God, this is amazing that I can feel so great just from doing this easy fast, right? And it's like, wow, I don't care, what else may come out of this. I feel fantastic. So after that point, I made a conscious effort. I had gotten a juicer to be part of this program as well. So getting into the healthy, the carrot juices and the like, and helping the system to heal itself. And I guess that's one thing I've learned over time, with Ruth, is that, hey, your body, if you're given, the right materials, and the right materials being, hey, the right food, the right mindset, and given the right environment, it actually heals itself.
It was in 1971 that I found myself not feeling well, tired, exhausted, depressed. I did go to the doctor. He checked me over. What happened was my breast was very blue and big. I had a large lump on my breast. It was a massive cancer, and it was quite bad because they had to remove the whole breast at that time. And my weight was 135 and went down to 108. When they sent me home, they told my husband that there was nothing more they could do for me. I was so bad that I couldn't walk, I couldn't talk. My friends came in to see me. I didn't even recognize them. I had a woman I worked for 15 years at the time. She came and she said, Doris, she's not gonna make it. She told my mother, she's gonna die. So my sister told my mother, we've got to get ready for my funeral arrangements. My mother had the doctor come in. He came in and he said, I don't know why I'm here. I can't help her anymore. Her cancer is all over her body. She is terminal cancer. I could give her more drugs. My mother said no. And then we went into nutrition. I couldn't eat. I couldn't swallow. All I did was drink juice, and it was a juice glass, and they put a straw in it, and they kept saying, Doris, you have to drink. I started with apple, carrot, and celery juice. That was sort of the main juice that I drank, and then they switched it to different other types of vegetable juices. But the pain that I went through, you go through reactions that it's unbelievable. I went through fever. They checked my blood pressure every day. My husband would come and say, Mrs. Sackman said there's reactions. And I said, what though? I'm not getting better. I was bleeding here again. It was broken again. And I can't do it. He says, you could. And you go through a lot of cleansing that causes, when your body is so toxic and it has to clean some way, and then with the cleaning, you get pain. And not to be afraid of the pain because it's a good sign. And one of my friends came in and said, Doris, you mean the diet does this to you? Your eyes are so bright and so white. You're like a baby. You got eyes like a baby. And so I said, I don't know. I just remembered my head was clearer. I knew my friends were coming in. It was a joy. I would talk to my husband and say, I feel so good, I can't believe it. I didn't think that I would be in this condition and feel so well. And my doctor called me. He says, I don't believe you're alive. And I said, yes, doctor, I'm alive. Please tell me, what type of cancer did I have? He says, you had number 4, and you were a very, very sick girl. It was impossible for you to get better. I couldn't have done it alone, and the help from my husband, my family, and especially Ruth Sackman. She was just wonderful to me. She's a knowledgeable, loving, and a kind person. That she understood me, and that's all that mattered. As she always said, it's not her that did it, and I respect her very much. She said, it was you, Doris. I couldn't make your salad for you. You did it. And that's the truth. You have to be the one that's willing from the heart and believe that this is going to work. It's not an easy program, but it's a program that it certainly does work.
Dr. Leventhal, I once read something that you said about your change in career from oncology to functional medicine. If I could quote you, I feel I was entirely at the wrong end of the spectrum. I was treating people at the last stages of their disease Most cancers start 10, 20, or 30 years before someone has symptoms or gets a diagnosis. Even when I was successful in treating them at the end of the process, I wanted to be at the beginning. Could you elaborate on that?
Sure. The oncology community as a clinical community is not really concerned with the causes of cancer. And whenever I went to meetings and attended plenary sessions and lectures and went to the prevention parts of the meeting, really the discussion was about early detection. And to me, early detection is not prevention. And that's, I think, a big failing of the clinical community to not really look at the possible roads to prevention. And I thought there was a separation between the people who were doing the research on the cellular and molecular level and the clinical people who were dealing with cancer as a disease.
Yeah. I would like to ask you about these 5 interviews that we've just seen. What was it that impressed you the most?
They're all interesting cases, and they're all really impressive people. What struck me the most was actually not the cancer cases, but the Lyme disease case. Because now in functional medicine, I'm dealing a lot with the clinical effects of toxins. So his story really struck me now as someone who figured out, along with Ruth's help, how to detox his body. And I just find that extremely fascinating and very hopeful, because there are a lot of people walking around with biotoxin illness, and it's fairly straightforward, I think, to recover if you know what to do.
And what about cancer as possibly a response to toxins?
I do believe in detoxification as one aspect of preventing cancer. I think it's very important, and the more I become aware of environmental issues, environmental problems with our food supply, the more I realize the importance of detoxification as a natural process, yes, but a process that needs help because we're living in a sea of unnatural chemicals.
Right. And I think it was also very impressive that almost all of the patients who pursued this program had reactions. It was Dina, I think, who said, well, I did the program for 3 or 4 weeks, and then I definitely felt worse.
Right. Yeah, that's a common finding with any sort of detoxification. As you start to mobilize various environmental toxins, and they start recirculating in the bloodstream and going out into the blood and into the stool, many patients do feel worse.
And then we consider that healthy if we're not having symptoms.
Right.
And then when we start to detoxify, we get sick.
Right.
So it is a bit of a paradox, isn't it?
Yes, it's hard to explain to people that feeling worse, having headaches or fever or some type of skin reaction is in the initial stages of a detoxification is actually a helpful sign that things are moving. There's such a strong tendency in modern medicine to try to treat every symptom and to turn symptoms into diseases. If somebody's having reflux, to put them on an acid blocker and block the reflux. If somebody's having an allergic reaction to an environmental irritant, to stop the mucus. And so many of our modern medicines are meant to block our own body's response to, probably a normal response to an irritant or a toxin. We try to squash any sort of unpleasant symptom, but it probably isn't the best thing for the body to do that all of the time.
And so this phrase or this term, the healing crisis, that's something that I never learned about in medical school.
Oh, no, never heard it. Detoxification wasn't discussed at all.
But do you think that it would make sense if you explained it to your colleagues, that a healing crisis is actually a valuable asset in the healing process?
I don't know. There's so many sort of fundamental philosophical differences between someone who's truly conventionally trained and thinks conventionally and someone like, like us, where we actually think a little bit more like a naturopath. It's a whole re-education that has to take place. And in talking to conventional physicians, it's hard to move them to that point and to get them to the point to recognize that detoxification is a normal and desired purging of some kind or normal activation of the immune system. I think that would be very difficult.
Rita was actually one of your patients, wasn't she?
Still is.
She still is, yeah. Can you tell us a little bit about your experience with Rita?
Well, Rita became one of my teachers, actually. She came to me, I think it was several years after she was diagnosed with renal cell cancer. She had multiple lung nodules at the time of diagnosis. She had x-rays demonstrating the lung nodules. She had a path report showing the renal cell cancer. And then she had some diet and lifestyle changes and had resolution of all of her pulmonary nodules. And when I saw her, she actually had a normal chest x-ray and was what we call in oncology NED, no evidence of disease.
I once met Doris Sokosh at one of Ruth's conferences, and I went up to her afterwards and I said, "Did this experience change you in any way?" And she said, "Oh, yes." And this is, I think, and also I think it was McCall who said, it's really a total transformation.
Yeah, when I was watching McCall, I had that sense. It jumped off of the screen, the strength that she had to, to walk away from the conventional treatment and this certainty that she could figure this out.
Something that Dina said in his interview is that he basically pointed out the aspects of the program, and then he said, but you really have to be your own doctor. He says it takes a lot of resolve. And do you find that to be true in your patients who do well as compared to the ones who maybe don't do as well?
There are many patients who really still have a very paternalistic view of medicine where the doctor knows better and they just want to follow the standard protocols, whatever the doctor thinks. And then there's the other kind of patient that wants to be involved in their care, wants to act, and in the extreme wants to actually help find the right care for themselves and maybe put together several different things that they've come across.
Would you say it's a difference between being a passive patient and being an active patient?
Absolutely. An active patient for me was a pleasure because I really felt like I was going on a journey with them and I was going to learn something too. And it was a different thing each time. And a passive patient is willing to let things be done to them and then holds the medical system responsible completely for the outcome. So it's easier, superficially it might seem easier to have a passive patient, but actually it's harder because they will not take any responsibility for outcome at all. It's all the success or failure is the success or failure of your system, your drugs, your office. So that's a very difficult situation to be in as a physician. I always enjoyed the active patients more.
And do you think fear plays a big role in that?
Oh, fear is a tremendous, leaving conventional treatment for something that is, not in the textbooks, is none of their friends are doing or have heard of. That's very difficult for a patient to do. It takes a lot of courage and a lot of spirit and strength to do that.
One of the ideas that was a core concept in Ruth's system is that you don't just treat the tumor, you don't just try to kill the tumor, but you really look at the bodily balance, the bodily condition that created the tumor.
that is something that is not addressed in conventional oncology at all. And yet, for example, we know that people who have had Hodgkin's lymphoma have a higher incidence of developing non-Hodgkin's lymphoma, or patients who sometimes have one type of lymphoproliferative disease, like a low-grade lymphoma, can then be diagnosed with a high-grade lymphoma. So clearly there's something systemic. Patients who have had one breast cancer are at increased risk for a second breast cancer. Everybody knows this, and yet there's no real thought or system for dealing with risk reduction in any sort of real way. And I think that in that sense, Ruth was very, Ruth's system and many of the integrative medical systems that are out there really do have it right, because it's really all about root cause.
Do you see a movement in the medical establishment that things might be changing? Points of view, the thinking is changing, perhaps broadening a little bit?
There are some small changes. I see that many physicians, I think, are becoming wary of the pharmaceutical industry and its agenda, and beginning to realize how that has dictated their agenda and dominated their treatments and diagnoses over the years. You can influence physicians, one at a time with very extraordinary cases, but you also have to work from the top down. You have to have textbooks, you have to have studies, you have to get into medical schools, and you have to get before Congress, because we have to change the way that we do medicine in the country. We simply can't even afford to do it the way that we've been doing it.
It is important to point out that to heal oneself from cancer is a difficult task, and it requires much courage, determination, and practical knowledge. One's chances of success are greater with the help and guidance of an experienced practitioner and with strong support from family and friends. The patient's condition and progress must be carefully evaluated and monitored. We encourage doctors and patients to research the work that has been done in this area. The nutritional restorative treatment of cancer is not a one-size-fits-all treatment. Each patient is a unique individual, and the treatment must be tailored to individual needs.
It's so interesting how the body responds, and amazing, actually. We don't have enough faith in the body's ability to heal. And so what happens when you give the body all of this good food and you correct whatever is broken down and not functioning well, the body automatically goes into play and does whatever it has to do to make the correction, which human beings couldn't do mechanically as they would like to. The body takes over, and it is powerful in its healing capacity. All the research is aimed at killing cancer cells, reducing tumor size, whether it's with surgery, radiation, or chemotherapy. And to date, it doesn't cure, it buys time. I would like the medical community, after surgery, when surgery is appropriate, to start the repair program instead of radiation and chemotherapy immediately and do that damage, which is hard to overcome. Instead, to take the body at the safest point, the healthiest point, and start the repair. It's not just fruits and vegetables that are raw. We need protein, we need starch, we need every element that is necessary for health and to build cells, or it's actually to build cells which provides the health. A healthy body with a healthy immune system will automatically reject any foreign material that the body has accumulated. I don't want to give a large body of people a direction of changing the lifestyle, because I believe coming from a bad lifestyle, they need careful help They need some guidance to make that change. It has to be made slowly. I'd like to see the medical community change its method of treating cancer so that every patient or any patient can go to their local hospital nearby, near home, and get the kind of treatment that is required in order to recover. Instead of having to search the internet, go to far-off places to get help. I'd like to see that in every institution in the country.